Hi guys, listen, I have 2,500 videos, okay? So bad.
So that's a bit odd because that's not the dose that was used in the study that he was quoting.
2,500 bad.
Dr. Eric Berg is a chiropractor who runs one of the largest health channels on YouTube, with over 14 million subscribers and a steady stream of views coming in every month, with thousands of videos covering a wide range of health topics. Chiropractic training is mainly built around the spine, joints, muscles, and nervous system. Chiropractors can diagnose and treat problems inside that scope, but that is not the same as being a medical doctor trained to manage a wide range of diseases, prescribe medication, or handle complex internal conditions. So when his videos move from back pain into nutrition, hormones, mental health, chronic illness, and disease prevention, it raises a fair question. Should someone with that background be treated as a reliable source for general health advice? A lot of the advice centers on simple answers for complex health problems. Certain foods, supplements, or routines are presented as if they can address a wide range of conditions. One example is oregano oil and herpes. There is research showing that some essential oils or compounds inside them can affect herpes viruses in lab settings, but that does not automatically mean taking oregano oil itself as a herpes treatment in real people. That difference is important. A lab result can show biological activity, but it is not the same as a proven clinical treatment.
And number two, I would also recommend certain natural antiviral compounds like monolaurin. This comes from coconut oil.
And this is where these claims become easy to believe. Simple advice feels practical. It gives people something they can try right away. But when the reasoning behind the advice does not line up with the established medical evidence, personal experience can fill the gap. In clinical settings, people can sometimes feel better after taking something even when the treatment itself is not directly causing the improvement. That is part of the placebo effect. Expectation, belief, and the care around a treatment can influence how someone feels. So if someone tries a supplement and feels better, they may treat that as proof. But feeling better does not always prove the supplement caused it. That is how weak health claims can gain traction quickly, even without strong evidence behind them. One of the most repeated topics in his content is vitamin D. He connects it to a wide range of symptoms, including mental health and physical issues, and often presents it as something most people are lacking.
Starting with probably the most important one, which is vitamin D. One thing you need to know about vitamin D is that we have a lot of resistance against absorbing vitamin D for all sorts of reasons, from the lack of sun because we're not outside as much, depending on the season, where you live in relationship to the equator, how old you are, how much you weigh, if you have insulin resistance or diabetes. You can override all these problems by just taking more vitamin D3. You would need to have at least 10,000 IUs to up to 50,000 IUs every day, and even more than that.
But according to the NIH Office of Dietary Supplements, the recommended intake for most adults is much lower, usually 600 to 800 IU per day, and the adult upper limit is 4,000 IU per day. So even 10,000 IU per day is already above the usual adult limit, while 20,000 to 50,000 IU per day is far above standard guidance for most adults. Yet he doesn't stop there.
What I would recommend for the average person is to take at least 10,000 IUs every single day. And on top of that, get some sun if you can.
The problem is the comparison does not reflect how the body actually uses vitamin D. The body does not consume everything circulating in the blood each day. Vitamin D also stays in the system for a long time and can be stored in fat, which helps maintain levels even when intake is lower. There is also a safety concern. Regular intake at those levels can increase the risk of too much calcium in the blood. NIH says too much vitamin D can cause symptoms like nausea, weakness, confusion, dehydration, excessive urination, despite the dehydration, kidney stones, and in extreme cases, kidney failure. In one video, Dr. Eric Berg talks about niacin and cholesterol.
There's a lot of research on niacin that goes back decades. And you want to get the niacin that gives you the flush. I would recommend an extended release niacin at 500 milligrams and do at least one a day. All right, so let's talk about what it can actually do. It significantly lowers your cholesterol.
The basic idea is not completely made up. Niacin can affect cholesterol numbers, especially at prescription level doses. The problem is how the advice is presented. When high dose niacin is used for cholesterol, it is usually treated more like a drug than a normal supplement. It can cause side effects, it can affect the liver, and it should be supervised by a medical professional.
So that's a bit odd because that's not the dose that was used in the study that he was quoting. Remember, they used 3 grams a day, so not the 500 milligrams that Dr. Berg is recommending.
And this is one of the cleaner examples where a confident recommendation does not fully line up with what is widely accepted in medical guidance. Here's what someone said after following his advice and ordering supplements. Another idea that shows up in his content is fasting, including a version that removes both food and water for a set period. He compares it to a common religious practice and presents it as something that can improve health.
I think it can produce massive results, even if you do it in a smaller scale. Why? Because 1 day of dry fasting is equal to 3 days of water fasting.
The issue is that there is no strong clinical evidence showing that 1 day of dry fasting gives the same health effect as 3 days of water fasting. Some religious fasts do involve avoiding water for part of the day, but that is not the same as proving dry fasting is a better health strategy. Most fasting research still allows hydration, and removing water adds risks that are not well studied for general use. Medical sources warn that dry fasting can lead to dehydration and kidney-related problems, so that comparison needs much stronger evidence before being treated as health advice, let alone fact. A similar issue comes up with statements about raw milk.
There's been some research done to show that children that consume raw milk versus pasteurized milk have lower incidence of asthma, allergies, decreased incidence of ear infections, and eczema, and even less respiratory infections.
Some studies have found a possible link between children drinking raw farm milk and lower rates of asthma or allergies, especially in farm environments. But those studies are not the same as proof that raw milk should be used as a health treatment. The issue is not whether the claim came from nowhere. It is that the possible benefit is still being studied while the safety risk is already well known.
So if breast milk is so good, why is cow's milk or goat's milk so bad? That's what I want to discuss. If you have a healthy environment for that cow and that cow is healthy, then what's really bad with milk? First thing is pasteurization.
That is why public health guidance generally advises against drinking it. Raw milk can carry harmful germs like Salmonella, E. coli, Listeria, and Campylobacter, and pasteurization is designed to kill those germs before people drink it. Another major focus in his content is the ketogenic diet. If you have seen his channel before, this is kind of hard to miss. A large portion of his videos connect the different health concerns back to keto, often presenting it as a possible answer for problems that usually need more careful medical guidance. One example is kidney disease. In one video, he asks whether keto can reverse kidney disease and points to an 8-week study. He says it showed a complete reversal of the albumin-creatinine ratio, and later says there was a partial recovery of kidney damage.
So in this video, I'm going to answer a question that someone wanted to know. Can keto actually reverse kidney disease? It was done for 8 weeks. It was on mice, but it showed a complete reversal of the albumin-creatine ratio using the ketogenic diet. And in just 8 weeks, there was a partial recovery of kidney damage.
But that does not make keto a proven way to reverse kidney disease in people. Kidney disease can have different causes and different stages, and diet advice usually needs to be handled with a medical professional, especially when kidney function is already impaired. At the very least, consult a nutritionist. The National Kidney Foundation says people with kidney disease can benefit from working with a kidney dietitian because nutrition needs can change based on the person's condition, lab results, and stage of kidney disease. It is absolutely not a one-size-fits-all situation. That connects to the bigger issue with his content. Keto is not presented as one limited tool for one specific situation. In his broader advice, it often becomes part of a larger system: low carbs, fasting, high-dose vitamin D, and a more positive view of saturated animal fats and red meat. That puts his advice outside the usual public health message. The American Heart Association still recommends limiting saturated fat because it can raise LDL cholesterol, and high LDL cholesterol is linked with higher heart disease risk. For red meat, the American Heart Association also recommends choosing fish, skinless poultry, beans, nuts, and lean meats, while limiting processed meats and fatty cuts of meat. There is also a clear stance on how people should view traditional medical advice. Dr. Berg often suggests that doctors may overlook important information, especially when it comes to nutrition and supplements.
You go to the doctor and they might ask you about what you're taking, and you say, I'm taking these vitamins, I'm taking magnesium, and they're going to just kind of go, oh, you don't need that. You can get that from your diet. And then you accept it. Unfortunately, just because someone has an MD behind their name or even a PhD behind their name.
To be fair, doctors do not always receive deep nutrition training. Older reviews of U.S. medical schools have found nutrition education was limited, and more recent medical groups have pushed for stronger nutrition training in medical education. So, questioning medical advice can be useful. Patients should be able to ask why something is recommended, what the evidence is, and whether diet or supplements are relevant. Second opinions are a thing. But the way this message is presented can also shift trust away from medical professionals and place more weight on his own explanations. That becomes risky when the advice involves high-dose supplements, fasting, kidney disease, or other issues where a person's medical history can change what is safe. A safer approach is not trust doctors blindly or ignore doctors completely. It is to ask questions, get a second opinion when needed, and use qualified medical guidance for conditions that can carry a real risk. A lot of the recommendations connect back to supplements and products sold under his branding, so it helps to look at how the supplement business works. Many supplement brands do not personally manufacture every product they sell. In the supplement industry, outside companies can handle manufacturing, packaging, labeling, or holding products for another brand. FDA rules cover those steps under dietary supplement manufacturing standards. Dr. Berg's own site says his supplements are manufactured in CGMP certified facilities. That does not automatically mean anything improper is happening. Outside manufacturing is common in the supplement industry. But it does not mean the product people see on camera is not only about health advice. It is also part of a branded product business. His shop sells dozens of supplements, from electrolyte powder to vitamin D products to adrenal, gallbladder, blood sugar, and digestion support. The store also includes the standard supplement disclaimer saying the statements have not been evaluated by the FDA and the products are not intended to diagnose, treat, cure, or prevent disease. When you look at how his recommendations play out in real examples, some inconsistencies start to show. In one of his own meal breakdowns, he walks through what he eats in a day. The meal is built around high-fat animal foods, including eggs, butter, bacon, sausages, and hot dogs. That's a lot of red meat.
So my first meal is at 1:30. They're pasture-raised organic eggs. In addition, I'll do 6 slices of bacon or 3 sausages or 2 grass-fed hot dogs, okay, with the eggs.
That kind of meal can bring a lot of saturated fat and sodium into one sitting, especially when butter and processed meats are part of the plate. And this is where the advice starts to clash with itself. His own healthy keto approach says it emphasizes nutrition-rich, unprocessed foods, but bacon, sausages, and hot dogs are still processed meats, even when they are grass-fed, organic, or marketed as higher quality. This goes beyond whether the meal is low-carb. It shows a gap in how he defines healthy. He tells people to avoid processed meats in his guides while including them in his own eating pattern. One of the more public controversies come from his own son, Ian Rafalco, who posted a video making serious claims about his father's connection to Scientology and his financial support of the organization.
Not only is this man a Scientologist, but he donates copious amounts. His profit margins are insane. They're through the roof. So he's donated probably around $7+ million. And every product of his that you buy, you donate to Scientology as well. Because he has a separate savings account just for that.
The exact amount is hard to verify from public records alone, but Berg's name has appeared in Scientology donor material before. Scientology's Impact magazine listed him as the Silver Meritorious Donor level, which is tied to $500,000 in donations to the International Association of Scientologists. The same background also came up in a workplace lawsuit. A former employee, Brenda Valentine, filed a case against the Health and Wellness Center Incorporated, alleging that participation in Scientology-related programs affected her job. According to the reported complaint, employees were expected to read and apply L. Ron Hubbard materials, attend Scientology-related programs, and workplace progress could be affected by participation. The complaint also said Valentine was demoted, her pay decreased, and she was eventually terminated after resisting participation. The case was later reported as settled. In 2007, the Virginia Board of Medicine entered a consent order involving Dr. Eric Berg's chiropractic practice. He was reprimanded, fined $1,500, and his license was placed under terms and conditions. The board listed several problems, including treatment outside the scope of chiropractic medicine, inadequate medical record keeping in multiple patient cases, and false or deceptive advertising. The order also required him to stop using or promoting several methods in his clinic, including body response technique, Nembutalpan's allergy elimination technique, contact reflex analysis, and testing with an acoustic cardiograph. He kept his license, but it was not a clean pass. For a period of time, the board placed limits on what methods he could use and how he could practice. The same Virginia Board newsletter later listed him as being in compliance with the terms ended and his license restored to full and unrestricted status in 2008. His claims often go beyond what is widely supported by health experts. This shows up in his advice on high dosages, fasting, and specific supplements. Some of his own recommendations even contradict each other. Also, his entire business is built on selling products he promotes in his videos. But let me know what you think in the comments, and don't forget to subscribe before buying Dr. Berg's supplements.